ABC 7 News at 7 weeknights.
A clinical trial for Alzheimer's disease is recruiting Suncoast residents. ABC 7's Alex Redmond joins us now with how this medical treatment differs from traditional ones. Alex?
Thank you, Scott. AC-1204 addresses the metabolic defects seen in the disease rather than addressing amyloid or tau, and it may be more pleasant to palate than other standard treatments. Another tool in the fight against Alzheimer's.
Well, it has a code name, but we call it the Accera trial, A-C-C-E-R-A trial.
It's not a pill or vaccine.
This is a medical food, so this is you drink a shake every morning, but it's something that has to be prescribed. So it has certain features in it that provide ketone bodies to the brain, which are a great energy source, and we think this may be beneficial for people with Alzheimer's disease.
Hundreds of people nationwide, including on the Suncoast, are enrolled in the study, says Dr. Andrew Keegan of Roskamp Institute. And now they're looking for more people to participate.
Yeah, we think this is kind of a different mechanism. Some of the newer medicines, people are approaching amyloid and tau and inflammation. So this is actually different, going at the mitochondria and how efficiently they are being used in the brain.
Geriatrician Dr. Heather Capello of Sarasota Memorial Hospital says the clinical trial involving medical food is a wonderful thing for Suncoast residents that may have Alzheimer's disease.
Oh, absolutely, especially the elderly. They have tons of medications. They come in with their brown paper bag of about 20 bottles. So to take something in substitute of a pill.
This, says Dr. Capello, would give them an alternative and something else.
It will give them hope, because in an era right now where there's science that's constantly looking at new things to help with this disease process, anything is a light at the end of the tunnel.
Because this is a medical food, says Dr. Keegan, people with gut sensitivity, such as IBS, Crohn's disease, or colitis, may not be eligible for this particular clinical trial.
When you're drinking a shake, some people may feel bloated, or, it's another thing you're drinking. So, but otherwise, I kind of feel more comfortable with this than a medication. So that's what makes it more appealing to subjects.
Another tool in the fight against Alzheimer's, well, it has a code name, but we'll call it the Accera trial. It's not a pill, it's not a vaccine, but it is going to help people. And, hey, what can I tell you?
Well, any correlation then between this shake and the things we do in our daily lives that, may have a positive effect on slowing down Alzheimer?
Yeah, absolutely. Because what it does is it deals with inflammation and it deals with the brain. And we know that things like sugar or carbohydrates, specifically packaged things that turn to sugar in the brain, causes inflammation. It causes inflammation in the body. So like anything else, with Alzheimer's disease, they are finding out that there's a correlation between inflammation and the brain. So, you know what, it's better to do things nutritionally if you can. And as Dr. Capello said, and Dr. Keegan, if you have an opportunity to take something which is nutritional, it's beneficial rather than a pill or a shot.
Okay. All right, Alex, thank you. Let's get over to Bob.